There's four things I think I'd like to cover in the context of my remarks. Firstly, just to set out the context of Birmingham and some of the health challenges that we faced. Then to set out some of the challenges that we face financially as a local authority and the implications of that. A little bit about what we're trying to do in the current context of that very disjointed health economy. And also to offer some comments on where I think we might get, should we get a Labour government elected in May, and be able to respond in a very positive way, I think, to the plans that Andy Burnham and his team have set out. But my starting point is, if you look at Birmingham, and I think the facts around health in this city spell out in the starkest possible terms the degree to which there is severe and significant inequality that still scars too much of this city. You know, there's a lot of statistics you can trot out around unemployment, around educational attainment, low pay, but I think the health statistics are the most striking of all. I don't think anything can illustrate inequality more starkly than the fact that you can add or subtract 10 years to your life expectancy simply dependent on the postcode in which you live. That sets out the scale to which this is still an unequal city. The fact that those are the places where you're more likely to be, well, less likely to be physically active, more likely to eat poor food, more likely to smoke, more likely to develop those kind of chronic conditions that then create real health problems and frankly, die younger. So I think tackling those inequalities has to be our absolute core mission as a city, and ensuring that we're removing those barriers to people living a better and a healthier life. And that's very much core business for me as the Cabinet Member for Health and Wellbeing. I've got responsibility for adult social care, I've got the public health stuff, I've got the supported housing and homelessness piece, and also I chair the City's Health and Wellbeing Board as well. So this is absolutely central to our mission. So we know we've got a really ingrained, well-established pattern of inequality, and that would tax our resources to deal with, I think, at the best of times. But as Philippa said at the start, we're trying to deal with this in the context of some of the deepest and most savage cuts to local government budgets in living memory. Local government and welfare, very much the front line of the health and social care system in this country, have borne the brunt of those cuts that the coalition government has brought through since they came to office in 2010. Now, for Birmingham, that combination of those cuts, plus the pressure that comes and more people needing our services, that means we're looking at having to take out something around the region of 800 million from the council's controllable budget. It's around about 60% between now and between 2010 and 2018. In the next year alone, we're having to find another 200 million, and that's on top of the 460 million that we've already had to take out. And of course, what's made it worse for Birmingham is the very unfair way in which those cuts have been loaded. They leave the urban areas, big cities like ourselves, at a severe disadvantage. Because of our issues around deprivation, we're far more reliant on central government funding. So, if I take you through the budget, 67% of the City Council spending is funded through government grant. Only 8% of what we spend comes through the council tax that we raise locally. So when those cuts come, we're really exposed and incredibly vulnerable. And the way in which they've been apportioned so unfairly means that the cut in our spending power this year is equivalent to £147 per dwelling in the city. That's at the same time that some authorities in southern England, I have to tell you, some areas here redolent of deprivation, Windsor, Maidenhead, Buckinghamshire, Wokingham, which has become something of an old friend if you've been to a number of meetings recently, they're actually seeing an increase in their spending power when we're seeing ours cut. So you have to ask, where is the fairness there? So faced with that situation, we know that we can't handle those pressures in the way that we traditionally have as local government. We used to call it salami slice, and you take a bit off here and a bit off there and manage to muddle through that way. We're in a very different space now, and I think Albert Bohr, as leader of the council, was quite right when he said this is the end of local government as we've known it, because that's the situation we're now in. So we've got pronounced inequalities at the very time when we desperately need those resources to deal with those and the capacity to support the most vulnerable. We're being, frankly, cut to the bone. And it's rather worrying when you see George Osborne's pronouncements about what might happen should he carry on as Chancellor after May, where clearly local government and welfare are in the front line again. They'll be the target of that next stage of the austerity drive. And frankly, I think that would push an already tottering system of social care in this city over the edge. So it's a rather grim picture that we see. But despite the cuts and the fact that we're we get some money from the NHS in the city, about 25 million. This is so-called Section 256 money to underpin social care. We've managed to maintain our obligations to meet our statutory duty, to meet the care needs of those who are in critical or substantial need. But to put that into context, they're the people who have the most profound and pressing care needs. So we've got 140,000 people in Birmingham who are aged over 65, but the council's only providing funding packages for about 10,000 of those people. And around under 3,000 of those are in permanent residential or nursing homes. And there's a similar picture if you look at the care for younger adults as well. Now, the pressure on those services is going to continue to grow, partly because of the finances, but also the demography of the city. So we expect to see more people in the coming years presenting with those critical and substantial needs. If you just look at the statistics around dementia in the city, for instance, we expect the number of people with dementia to grow by 20% over the next 6 years. So that's another potential pressure that's building up for those care services. Now, I think the sensible way that you try and approach that pressure would be to try and stop the things that lead to people needing that kind of intensive care, that very expensive care provision. Trying to prevent those causes of chronic ill health, stepping in and helping people earlier, whether that's get through enablement, whether that's using assistive technology, or just simple social care support and improving local activity. That's obviously better than waiting until people get into the state where they have a critical or substantial care need. Certainly better for them, and of course it's better for the public purse as well. But the conundrum and the challenge that we've got is that when your budgets overall have been slashed so heavily and you're struggling to meet your obligations to those who need the most intensive support, finding the money to invest or sustain any kind of early intervention or prevention activity, which, unlike meeting the substantial and critical care needs of people, isn't a statutory duty, that becomes an increasingly difficult thing for local authorities to do. So we pushed into this rather perverse position, if you like, of having to cut the very things that remove the future pressure from our statutory services, simply in order to keep those statutory services going for the present set of citizens who need to use them. You know, that isn't sustainable, it isn't sensible, and it needs to change. So what we've tried to do in Birmingham is at least protect some of that prevention work. So, for instance, we're still continuing to support housing-related support, helping vulnerable people to sustain their tenancies, to find work and training by retaining a good chunk of the Supporting People programme. In fact, we've been able to mitigate some of the proposed budget cuts to sustain support for younger adults with mental health problems as a result of some of our decisions this week. But I think things like supporting people are really important in keeping people away from that front line of social care. I've just come back from spending a few days in Staffordshire, undertaking a peer review of the social services there. This is an arrangement we have between the local authorities in the Midlands. They're actually taking their Supporting People programme out altogether. And having seen the evidence that's come from some of that, I've come back absolutely certain that we've made the right call in trying to sustain as much of that activity as we can. We're also trying to do similar things in terms of keeping some money flowing into the voluntary sector for those community-based activities, the things that tackle isolation and loneliness, which frankly can be as destructive to health as some of those other physical conditions. And creating the opportunity just to bring people together is frankly a far better way in most cases than trying to medicalise the problem and issue medication. That's the kind of approach that we've tried to weave into Birmingham's Better Care Fund plan. This is the approach that's been taken nationally at the moment to try and do some of that health and social care integration that John referred to. So we're trying to work and pull the council's money and NHS money to sustain and increase that kind of preventative work. But I'm also really keen that we don't just limit our approach to health issues to silos. So you've got one that's called social care and you've got the one that's called NHS. As a local authority, we've got other powers and other influence at our disposal as well to drive forward that health agenda, to shape the environment and encourage healthier behaviours. So what we're looking to do at the moment is to apply a public health test to every aspect of council decision-making and policy. At the moment, we always look at legal implications and we look at the equality implications and the financial implications. But actually, we need to look at every act and ask the other question. Does this decision, does this policy encourage healthier behaviours? Does it increase physical activity? Does it maximise people's mental well-being? Does it encourage those healthy behaviours? Does a planning proposal encourage more people to walk? We know that walking is probably one of the most beneficial things you can do for your health. Are we using our licensing powers that we already have to our full effect? And I'd hope to see some more licensing powers come through to local authorities if we get a Labour government later this year. So, can we build on some of the work we've already been doing to restrict the growth of fast food outlets? So really hardwiring that kind of public health approach, maximising the ability to ensure people can live that kind of healthier lifestyle. So, just to touch on the obesity issue for a moment, which I know, Philip, you referred to earlier. 1 in 4, that's a quarter of Birmingham children, are not just overweight by the time they leave primary school, they're actually obese. And the long-term costs of that for their own well-being and indeed for the kind of conditions they will generate and the pressure on their health system, that's huge. Cost to the system that we reckon by 2050, if we carry on the current trajectory, obesity will amount to 2.6 million a year cost to Birmingham. So, that's why we need to hardwire that public health approach into what we're doing. So I think we've made a positive start in some rather difficult circumstances around some of this in the city. And I think there's certainly a shared will between the council and partners in the NHS to try and make this happen. But without extra resources and without a clear mandate to lead that fractured health and social care system, we can't deliver all that we want to and to try and really turn around that picture of inequality. So that's why I think the kind of proposals that have been issued in Labour's 10-year plan for health and social care are so absolutely welcome. I think there are 3 things I'd just flag up as particularly important here. One is that recognition that what goes on in a hospital depends on what goes on in the community. I think it acknowledges that fundamental truth that prevention is far, far better than cure, not just for the taxpayer, but for those individuals who are a better place to enjoy an independent and healthier life. Second, the fact that the plan tries to achieve that by ending this destructive and counterproductive division that we've got between the worlds of health and social care, trying to get away from that, having 2 systems running in parallel, or at worst in conflict at times. We're trying to build that single approach and bring those services together so they meet the needs of the individual rather than the institutions. And I think we've got an opportunity to build on that work we've already done in Birmingham to do that. But I think it also seeks to do that by delivering and observing a very important third key principle, which has already been touched on. Over the last 3 or 4 years, we've seen how destructive top-down imposed change can be to the system. That has just wreaked havoc throughout the health and social care system. And it's really debunked, I think, this idea that you can re-engineer the system from a room in Whitehall. That's been completely thrown out by our experience. What you need is local leadership, you need local decision-making, and you need an element of local choice. It should fall to Birmingham, frankly, to decide what Brummies need and how that is best provided. So I think the fact that the proposals seek to really strengthen the role of the Health and Wellbeing Board, giving it that clear mandate to lead that disjointed system is a really positive step forward. It gives us the opportunity to really drive forward the integration and ensure that we've got a combined health and care budget. So I think there's some real positives that we can build on there. Just leave you at this point. I think the next few weeks, the next few months are going to be absolutely crucial in determining the long-term future of the health and social care system in this city. And the decision that you as voters make in May will determine, frankly, whether we keep trundling on towards what I think is a huge disaster in the making around social care in this city, whether we continue to see further savage cuts in frontline local government budgets and continue to see this chaotic NHS structure there. That's the one option, or we've got the other option to do something that's genuinely focused around prevention, end some of those divisions between the system, and enables us to further drive forward a process that will ensure that we prevent the causes of ill health and really get back to tackling some of those inequalities that we know that the city faces. Thank you.